Hi guys, am I audible? Am I audible? Okay, I guess I'm audible and visible. So actually I'm very sorry for not uploading the videos because I was too busy in my schedule. And from today I will do some live streams, and we will get together. So today we are going to talk about the shock, its pathogenesis, etiology, clinical manifestations, and all others. Okay, so let's begin. Okay, shock. It's a very difficult topic, I guess, because okay, let's begin. So what is shock? So shock is a critical condition brought by a sudden drop in blood flow through the body. Shock is characterized by loss of blood, okay, an acute reduction of effective circulating blood volume, hypotension, and an inadequate perfusion of cells and tissues, hyperperfusion. Okay. If uncompensated, this mechanism may lead to impaired cellular metabolism and death. Thus, by definition, true or secondary shock is a circulatory imbalance between oxygen supply and oxygen requirement at the cellular level, and is also called as a circulatory shock. The term initial or primary shock is used for transient and usually a benign. Okay, so primary is not that severe. Okay, and usually a benign vasovagal attack resulting from the sudden reduction of venous return to the heart caused by neurogenic vasodilation and consequent peripheral pooling of blood. Example: immediately after fallen trauma, severe pain or emotional overreactions like fever, sorrow, or surprise. Okay. So what do we understand from this slide is that there are two types of shock: primary and secondary shock. Primary is transient and usually benign. It is localized towards that area only, and it is caused by the vasovagal attack. Now, what is vasovagal? Vagal, I know. Vagus is a nerve. Okay. Vaso means like blood vessel. So attack resulting from sudden reduction of venous return. Okay. So there is a reduction of like the blood. There is a deoxygenated blood. It doesn't make its way to the right heart. Okay, so that's why the right heart it becomes inflamed with the help of the sympathetic nerves. Okay, so and consequent peripheral pooling of blood. Okay, like the blood accumulates in the right heart. Okay, resulting in edema, swelling, and eventually the cardiac arrest. Okay, immediately following trauma, severe pain or emotional overreaction like fear, sorrow, or surprise. And secondary is the circulatory. Okay, it is true. Okay, second is true. Primary is initial. Okay, it's a circulatory imbalance between oxygen supply and oxygen requirement at the cellular level, and is also called as a circulatory shock. So, what are the five symptoms of this primary shock? So, first is a brief unconsciousness, weakness, pale and clammy limbs, weak and rapid pulse, and low blood pressure, hypotension. Okay. So we have totally six types of shock: hypovolemic, neurogenic, cardiogenic, hypoadrenal, then what? Septic shock, and last one is what is that? Damn, I forgot. Traumatic shock, traumatic. So we have six types of shock: hypovolemic, septic, traumatic, neurogenic, cardiogenic, and I again forgot it. Hypovolemic, cardiogenic, septic, traumatic, then hypoadrenal, and neurogenic. So first is the hypovolemic. Hypovolemic is because of a loss of blood volume from the body due to hemorrhage. That is the external cause, and internal hemorrhage like okay. So we'll discuss about the hypovolemic shock in detail. Okay. So first we have hypovolemic shock, cardiogenic shock, septic shock. Then there is the traumatic shock. Then there is the what is it called? Um, damn, traumatic shock, neurogenic and the neurogenic and what is it? Ah, neurogenic and hypoadrenaline. Okay, repeat. So hypovolemic, cardiogenic, septic or toxemic. Then we have the traumatic, neurogenic, and hypoadrenaline. Okay, finished. So, so now we'll learn this some short details about the hypovolemic shock. So this form of shock results from inadequate circulatory blood volume by various etiological factors that may be either from the loss of RBC, red cell mass and plasma from hemorrhage, or from loss of plasma volume alone. Okay, so there are two conditions in which we can find the hypovolemic shock. First is the hemorrhage, and second is the loss of plasma volume. Blood has two compartments, like blood cells and plasma. So plasma constitute about the 55% of blood. Okay, so and most of the plasma is composed of water. Okay, so whenever there is loss of water, then the BP of the person is drops and causes hypotension. Okay, T. So now cardiogenic shock, acute circulatory failure with sudden fail in cardiac output from acute diseases of the heart without actual reduction of blood volume. Okay. So in this type of shock, cardiogenic shock, there's problem with the heart. There's problem with the heart, not with the blood volume. The heart can't pump the blood towards the organ, so that's why it causes shock. Okay. And severe bacterial infection or septicemia induced septic shock. Okay. So hypovolemic due to loss of blood volume, then cardiogenic because of loss of the function of heart, and third is septic due to the bacterial infections. Okay. So traumatic shock resulting from trauma is initiated due to hypovolemic shock, but even after hemorrhage has been controlled, these patients continue to suffer loss of plasma volume into the interstitium of injured tissue, and hence is given separately in interstitium. Okay, so so this traumatic shock is a type of hypovolemic shock. Okay. Hypovolemic shock, what happens that there is loss of blood volume. Okay. In hypovolemic shock due to hemorrhage or due to the loss of plasma volume. Okay. But the thing in the traumatic shock is that it is different from the volemic shock because the plasma volume, it leaks into the interstitium of the injured tissue. Injured tissue. Okay. So therefore we consider it as a separate type of shock. Okay, but the thing is that it is involved in the hypovolemic shock. Okay, see. So neurogenic shock result from causes of a intrusion of sympathetic vasomotor supply, causes spinal cord injury, blocking of autonomic way regulation of peripheral relations by vasomotor centers, but instead nerve vagus cause decreased heart rate, bradycardia, and vasodilation, which leads to hypotonia. Okay. So, in the case of neurogenic shock, there is a interaction of a sympathetic vasomotor supply. Okay. So etiology of this neurogenic shock is that there might be a spinal cord injury, blocking of autonomic way regulation of peripheral relations by vasomotor center. Okay, but instead nerve vagus cause decrease. Okay, bradycardia and vasodilation due to hypertension. Okay. So what happens in the neurogenic shock is that there is a damage towards the spinal cord. Okay, so that's why the autonomic nervous system, it functions abnormally. Okay, so that's why what happened that the vagus now it stimulates the heart to undergo vasodilation. Okay, and causes the decreased heart rate and bradycardia. Okay, and vasodilation, which leads to the hypotonia. Okay. Now, the sixth type of shock is the hypoadrenal shock. Hypoadrenal shock occurs from unknown adrenal insufficiency, in which patients fail to respond normally to stress of trauma, surgery, or illness. Unknown adrenal insufficiency. You know, guys, there are on the kidney there are two bean shaped organs called the adrenal gland. So these glands can produce various chemicals like neurotransmitters like this epinephrine, norepinephrine, and this aldosterone. So in the hypoadrenal shock, what I mean that there is a adrenal insufficiency, like the cells of the adrenal gland, they can't produce the this type of neurotransmitters or a chemical steroids. Okay, so that's why we can see the hypoadrenal shock. Let me have some coffee. Okay. So we will summarize what we have just learned. So we have six types of shocks. First is the hypovolemic. Second is the cardiogenic. Third is the septic. Fourth is the traumatic. Fifth is this. Fuck. Neurogenic and sixth is the hypoadrenaline. Okay. Hypovolume, the name itself indicates that it is caused by the loss of volume. Okay. And cardiogeny, the name itself indicates that it is caused by the infunctioning of the heart. Okay. Then septic it is caused due to the severe bacterial infection. Traumatic it is a type of hypovolemic shock, but the thing is that even after hemorrhage, the plasma volume it continuously gets leaked out from the blood into the interstitium. Okay, then fifth is neurogenic. It is due to the injury to the spinal cord. It causes the autonomic nervous system to function abnormally and causes the vagus nerve to decrease the heart rate, bradycardia, and decrease the sorry, and causes the vasodilation and hypotonia. Okay, and hypertension, so shock, it is due to the adrenaline insufficiency, that the adrenal gland, it it is not it does not produce the adequate amount of hormones which are required for the normal functioning of the humans. Right. So now pathogenesis. Now this is very important. Pathogenesis of shock. In general, all forms of shock involve the following three D arrangements: reduce effective circulating blood volume. Okay. So all form, the six what we just discussed, all the forms have this 3D arrangements. Okay, remember. So there is a reduce effective circulating blood volume, reduce effective, reduce, come, effective circulating blood volume. Okay, so it may result by either of the following mechanism: by actual loss of blood volume as occurs in hypovolemic shock, or by decreased cardiac output without actual loss of blood, normovolumia, as occurs in cardiac shock and CPR. So what is the first point in the pathogenesis of shock? So first is the reduced effective circulating volume. Reduced effective circulating volume. So what I mean in this is that the blood volume is lost by the hemorrhage, as in case of the hypovolemic shock, and and it is not lost like in case of a cardiogenic shock, in which the heart it functions abnormally. So 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 the blood can't be pumped into the organs and causes the shock. That is called a cardiogenic shock. Okay, and septic shock, it is due to the bacterial infection. Okay, fine. Reduce effective circulating blood volume. Okay. Impaired tissue oxygenation. Now this is obvious. This is very simple. Now, as we discussed in the first point, there is a reduced effective circulating volume. Okay. रिड्यूस इफेक्टिव, सो द जो भी ब्लड जा रहा है अपने हार्ट, अपने पूरी बॉडी को, वो कम है, ठीक है। वो कम होगा तो क्या होगा, ब्लड के अंदर क्या रहता है, ऑक्सीजन रहता है। ऑक्सीजन किससे बाउंड रहता है, हेमोग्लोबिन से, ठीक है। और हेमोग्लोबिन जो है वो ब्लड के अंदर, और ब्लड जो है वो हार्ट के अंदर है, ठीक है, एज इन केस ऑफ कार्डियोजेनिक। सो क्या होगा कि अपना अपना ब्लड जो है वो जाएगा नहीं अपने ऑर्गन्स तक, ठीक है। और ऑर्गन्स तक जाएगा नहीं तो क्या होगा, ऑक्सीजन नहीं जाएगा। ऑक्सीजन नहीं जाएगा तो क्या होगा, हाइपोक्सिया होगा। हाइपोक्सिया नहीं होगा तो क्या होगा, हाइपोक्सिया होगा तो क्या होगा, अपने सेल जो है वो मर जाएंगे, ठीक है। सो impaired tissue oxygenation following reduction in effective circulating blood volume and decrease venous return. Yeah, decrease venous return in the heart, resulting in decreased cardiac output. Okay. This consequently causes reduced oxygen supply to the organs and tissues, and hence tissue anorexia, which sets in cellular injury. As we discussed in the previous live streams, we have discussed cellular injury. There are two types of cellular injury. First is the reversible, and second is the irreversible. Okay, so in reversible, the we have discussed. And third one, so release of inflammatory mediators. In response to cellular injury, innate immunity of the body gets activated and release inflammatory mediators, but eventually these agents themselves become the cause of cell injury. Okay. Okay. In a response to cellular injury, innate immunity of body gets activated and release inflammatory mediators, but eventually these agents become the cause of the cellular injury. Okay. Third one is the release of inflammatory mediators. Okay. Endotoxins in the bacterial wall in septic shock stimulate massive release of pro-inflammatory mediator cytokines, but a similar process of release of this agent takes place in late stages of shock from other causes. Several pro-inflammatory mediators are released from the monocyte macrophages, other leukocytes, and other body cells. The most important being the tumor nucleus, TNF alpha and interleukin 1. तो क्या होता है कि देख, अभी खून जो है वो बॉडी को जा रहा नहीं है, ठीक है। खून नहीं जा रहा मतलब क्या नहीं जा रहा, ऑक्सीजन नहीं जा रहा। ऑक्सीजन नहीं जा रहा मतलब क्या हो रहा, सेल कैंसर इंजरी हो रही, ठीक है। अभी सेल इंजरी हो रही तो क्या हो रहा कि अभी कुछ सेल जो है दे प्रोड्यूस प्रो इन्फ्लेमेटरी मेडिएटर। इनको आप ऐसे समझो कि इनको आप ऐसे समझो कि कि ये ऐसे मॉलिक्यूल है जो कि कॉज करते हैं इन्फ्लेमेशन, ठीक है। इन्फ्लेमेशन को कॉज करने वाले मॉलिक्यूल्स है, ठीक है। सो उनके अंदर सबसे इम्पोर्टेंट जो है वो ये है, ट्यूमर नेक्रोसिस फैक्टर, TNF अल्फा एंड इंटरल्यूकिन 1, ठीक है। सो अभी पैथोजेनेसिस ऑफ हाइपोवोलेमिक शॉक। हाइपोवोलेमिक शॉक क्या होता है? सो हाइपोवोलेमिक शॉक occurs in from inadequate circulating blood volume due to various causes, ठीक है। inadequate circulating blood volume, ठीक है। So causes are blood loss, hemorrhage, aneurysm, trauma, postpartum hemorrhage, ठीक है, and non-blood loss, third degree burns, vomiting, diarrhea, alteration in mental state, and agitated to confused to lethargy. Okay. So there are two causes of path for the development of the hypovolemic shock. First is the blood loss, and second is the non-blood loss. Non-blood loss. So ब्लड लॉस के अंदर क्या होता है कि हिमरेज हो सकता है, एनेरिज्म हो सकता है, ट्रॉमा हो सकता है, और पोस्टमार्टम हेमरेज। पोस्टमार्टम मतलब क्या कि जब बच्चा जो है वो डिलीवरी होता है, तब देयर आर वेरियस चांसेस that the blood can be lost from the mother as well. So it causes the postpartum hemorrhage. ठीक है. Now non-blood loss. Non-blood loss means third degree burns, vomiting, उल्टी आना, डायरिया मतलब पता है आपको, अल्ट्रेशन in mental state, agitated to confused to lethargy. Okay. So severity of clinical features depends upon degree of blood volume lost. Hemorrhagic shock is divided into types: 1000 to 1500 ml compensated, 1500 to to 2000 ml moderate and more than 2000 ml severe. Okay. Clinical features are increased heart rate, tachycardia, low blood pressure, hypertension, low urinary oliguria to anuria, and alteration in mental state, agitated to confused to lethargy. सो अब ये आपने आगे ब्लड 1000 मतलब 1 लीटर से 1.5 1 लीटर तक गया, तो आवर बॉडी कैन कंपनसेट फॉर इट, मतलब अपनी बॉडी जो है वो बर्दाश्त कर लेगी उससे, ठीक है। लेकिन जब 1.5 लीटर टू 2 लीटर जब ब्लड निकलता है तो मॉडरेट मतलब ठीक है, मतलब होता है अ, थोड़ा थोड़ा टाइम लगता है बॉडी को टू टू compensate फॉर दिस लॉस, ठीक है। एंड इफ द ब्लड लॉस इज मोर देन 2000 ml देन इट्स इवन the patient can die, ठीक है। So clinical features of shock are increased heart rate, tachycardia, low blood pressure, hypertension, ठीक है, low urinary output, oliguria to anuria, and alteration in mental state. So cardiogenic shock. अभी cardiogenic shock की pathogenesis क्या है? So cardiogenic shock results from a severe left ventricular dysfunction from various causes. ठीक है, left ventricle, left left. So causes are myocardial infarction, congenital heart disease, valvular disease, myocarditis, cardiomyopathy, and arrhythmias. ठीक है, so these are various causes of cardiogenic shock. ठीक है, now the resultant decrease cardiac output. अभी cardiac output decrease होगा क्यों? क्योंकि ये myocardial infarction ये सब हुआ है आपने को, ठीक है। So has its effect in the form of a decreased tissue perfusion. टिश्यू परफ्यूजन क्यों 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 कम होता है? परफ्यूजन मतलब क्या, कि कितना ब्लड जा रहा है एक टिश्यू को, ठीक है, तो वो कम होता है क्यों? क्योंकि हार्ट जो है वो ठीक से फंक्शन नहीं कर रहा, ठीक है। एंड मूवमेंट ऑफ फ्लूइड फ्रॉम pulmonary vascular bed into pulmonary interstitial space. Initially interstitial pulmonary edema and later into alveolar spaces, alveolar pulmonary edema. एडिमा क्या है? एडिमा क्या है एडिमा? है क्या एडिमा? सो एडिमा क्या है कि जब ब्लड जो है, ब्लड का जो प्लाज्मा जो है वो अपना अपना जो सेंट्रल सेंट्रल कंपार्टमेंट है, मतलब अपना ब्लड है, ब्लड से टिश्यू में जाता है तब उसको बोलते हैं एडिमा। सिंपल, ठीक है। हम्म। अभी सेप्टिक शॉक की पैथोजेनेसिस पढ़ते हैं। सो सेप्टिक शॉक रिजल्ट्स मोस्ट ऑफन फ्रॉम ग्राम नेगेटिव बैक्टीरिया एंटरिंग इन बॉडी एंड लेस ऑफन ग्राम पॉजिटिव। ग्राम नेगेटिव बैक्टीरिया अभी ये क्या भला है? ये मैंने सिखाया है, ओके, ये मैंने सिखाया है इन माय प्लेलिस्ट कॉल्ड लाइव स्ट्रीम माइक्रोबायोलॉजी इंट्रोडक्शन, आप देख सकते हो, ओके। सो ग्राम नेगेटिव बैक्टीरिया एंटरिंग इन द बॉडी सेप्टिक शॉक का कॉज है। इन सेप्टिक शॉक देयर इज इम्यून सिस्टम एक्टिवेशन एंड सीवियर सिस्टमिक इन्फ्लेमेटरी रेस्पॉन्स टू इन्फेक्शन एज फॉलोज। सेप्टिक शॉक में इम्यून सिस्टम को ज़्यादा चिल मचती है उसके अंदर, उसके उसके अभी ठीक है। सो एक्टिवेशन ऑफ मैक्रोफाज मोनोसाइट्स, ठीक है। सो अभी ये देखो मोनोसाइट और मैक्रोफाज के अंदर बहुत इंटरेस्टिंग रिलेशन होता है, ठीक है। मोनोसाइट जो है वो प्रीकस होते हैं, मतलब अपने पप्पा होते हैं मैक्रोफाज के, मतलब मोनोसाइट जो है वही मैक्रोफाज बनते हैं। जब जब मोनोसाइट ब्लड से निकलकर टिश्यू के अंदर जाता है तब उन्हें मैक्रोफाज कहा जाता है, ठीक है। और उनके अंदर बहुत मॉडिफिकेशन होते हैं, मोनोसाइट के अंदर बहुत मॉडिफिकेशन होकर मैक्रोफाज बनते हैं, जो कि वो बड़े होते हैं। मोनोसाइट्स छोटे होते हैं, मैक्रोफाज थोड़े बड़े होते हैं। मैक्रोफाज के अंदर क्या होता है कि दे हैव लॉट्स ऑफ एबिलिटी टू फैगोसाइटोसिस, ठीक। फैगोसाइटोसिस में बहुत काम आता है मैक्रोफाज। मोनोसाइट के अंदर इतना इतना फैगोसाइटोसिस की एबिलिटी एबिलिटी नहीं होती, ठीक है। Now, lysis of gram-negative bacteria releases endotoxin, a lipopolysaccharide, into circulation, where it binds to lipopolysaccharide binding protein. The complex of LPS and LBP binds to CD40 molecule on the surface of monocyte or macrophage, which are stimulated to elaborate cytokines. The most important ones are TNF-alpha and interleukin. As we have discussed in the previous slide, that TNF-alpha and interleukin are the very important pro-inflammatory mediators. ठीक है? Okay. So the effect of the cytokines are activation of other inflammatory responses, and microbial infection activate other inflammatory cascades, which are performed in triggering septic shock. तो सबसे पहले करते हैं एक्टिवेशन ऑफ मोनोसाइट मैक्रोफेज। तो मोनोसाइट मैक्रोफेज जो है, जब जब ग्राम नेगेटिव बैक्टीरिया का लाइसिस जब टूटता है, ग्राम ग्राम नेगेटिव बैक्टीरिया, तब वो रिलीज करता है एंडोटॉक्सिन। अभी एंडोटॉक्सिन जो है, ये CD14 रिसेप्टर्स ऑफ मोनोसोम और मैक्रोफेज के ऊपर आता है, मतलब उसके ऊपर बाइंड होता है। ठीक है, बाइंड होने के बाद क्या होता है कि दे मोनोसाइट और मैक्रोफेज जो है, दे स्टार्ट रिलीजिंग टीएनएफ अल्फा एंड इंटरल्यूकिन 1, टीएनएफ अल्फा एंड इंटरल्यूकिन 1। ठीक है, सो जब ये टीएनएफ अल्फा एंड इंटरल्यूकिन 1 जो है, ये रिलीज होता है जब, तब ये दोनों क्या करते हैं कि दे एक्टिवेट अदर प्रो इन्फ्लेमेटरी मेडिएटर्स। ठीक है, एंड and the microbe itself causes the activation of a specific inflammatory cascades, जो कि बहुत इंपॉर्टेंट है इन द केस ऑफ सेप्टिक शॉक। ठीक, सो these are under activation of mast cells। हाँ, सो ये टीएनएफ अल्फा अल्फा एंड इंटरल्यूकिन क्या करते हैं, ये क्या करते हैं, ये चुगली करते हैं मास्ट सेल्स को। मास्ट सेल्स को क्या कहते हैं कि हिस्टामाइन रिलीज कर चल, histamine is released, which increases the capillary permeability. Activation of a complement pathway N protein C5 and C3A induce microembolia and endothelial damage, altering endothelial adhesiveness. This results in requirement of more neutrophils, which liberate free radicals that cause vascular injury. And B is the promoting nitric oxide synthase, which is responsible for vasodilation and hypotension. हम्म, टीएनएफ अल्फा इंटर के बहुत चुगली है, बहुत उंगली करते हो। ओके, ओके, sama dimension. Okay, so activation of kinin system, release bradykinin causes vasodilation and increase capillary permeability. The net result of our mechanism is vasodilatation and increased vascular permeability in septic shock. Perform peripheral vasodilation and pooling of blood causes hyperdynamic circulation in septic shock, in contrast to hypo. Oh, okay. Okay, 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 okay. So, so septic shock is different from hypovolemic and cardiac. Why? Because in this case, there is hyperdynamic circulation of blood in septic shock because of vasodilation. Perform peripheral vasodilation. Perform peripheral vasodilation. Peripheral पूरी पूरी बॉडी में vasodilation होता है, पूरी बॉडी में। ओके, ठीक है, ओके। So, increased vascular permeability causes development of a inflammatory edema. Reduced blood flow produces hypotension, inadequate perfusion of cells and tissues, finally leading to organ dysfunction. ठीक है. So bacteremia and aggravated organism reduce production. ठीक है. हम्म, 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 हम्म. Okay. So, what are the clinical features and complications? So, the classical feature of decompensated shock are characterized by depression of four vital processes. So, very low blood pressure, subnormal temperature, irregular pulse, and shallow and sighing respiration. In addition, the patients in shock have pale face, sunken eyes, weakness, and cold and clammy skin. Life-threatening complications in shock. So, they are due to hypoxic cell injury, resulting in immunoinflammatory responses and activation of various cascades, clotting, complement, and kinin. T. These include the following: acute respiratory distress syndrome (ARDS) is caused by protein-rich pulmonary edema that causes severe hypoxemia and impaired carbon dioxide excision. The clinical features associated with the development of ARDS include sepsis, pneumonia, aspiration of gastric content, and trauma. Increased capillary permeability is the hallmark of ARDS. Okay. Pathogenesis. So, guys, the main culprit in this whole thing is the endotoxin. ठीक है. अभी अगर बैक्टीरिया ने एंडोटॉक्सिन रिलीज नहीं किया होता तो फिर एंडोटॉक्सिन ने मोनोसाइट और मैक्रोफाज को स्टिमुलेट नहीं किया टू प्रोड्यूस दिस इंटरल्यूकिन एंड टीएनएफ अल्फा. ठीक है. इंटरल्यूकिन टीएनएफ 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 और टीएनएफ अल्फा और अल्फा वन टीएनएफ अल्फा एंड इंटरल्यूकिन 1 जो है, वो अगर प्रोड्यूस नहीं हुआ है तो फिर प्रो इन्फ्लेमेटरी मेडिएटर्स को उन्हें बनाना होता. और अगर टीएनएफ अल्फा सॉरी प्रो 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 इन्फ्लेमेटरी मेडिएटर बने नहीं होते तो फिर क्या होता कि अपना ये जो अपना सारा सिस्टम है, जैसे कि काइनेज सिस्टम हुआ, कॉम्प्लीमेंट हुआ, अपना दूसरे कुछ सिस्टम है जो कि इन्फ्लेमेशन कॉज करते हैं. ठीक है. तो वो एक्टिवेट नहीं हुए होते. आपने परमेबिलिटी ऑफ द वैस्कुलर एंडोथेलियम ज्यादा नहीं होती, जिसकी वजह से एडिमा ना होता. ठीक है. सो समझ में आ रही है बात. सो जी. सो pathogenesis. The pathogenesis of ARDS is not well known. Risk factors: inflammatory cells, stimulated pro-inflammatory cytokines, and mediation release. Dimension. जी. Hmm. So DIC, disseminated intravascular coagulation, is a condition in which blood clots from throughout the body, blocking small blood vessels. Symptoms may include chest pain, shortness of breath, leg pain, problems speaking, or problems moving parts of body. Acute renal failure (ARF), multiple organ dysfunction syndrome (MODS), with progression of a condition the patient may develop stupor, coma, and death. God damn, कितना सारा है. Okay. So there are three stages of shock. First is the compensated, that is also called initial, reversible, and non-progressive shock. Second is the progressive decompensated shock, and third is the irreversible decompensated shock. So in compensated shock, what happens? It is non-progressive, initial, and reversible shock. In the early stage of shock, An attempt is made to maintain adequate cerebral and coronary blood supply by by redistribution of blood so that the vital organs, brain and heart are adequately perfumed and oxygenated. This is achieved by activation of various neurohormonal mechanisms causing widespread vasoconstriction and by fluid conservation by the kidney. If the condition that caused shock is adequately treated, the compensator may be able to bring about recovery and re-establish the normal circulation. This is called compensated or reversible shock. This are as under widespread vasoconstriction. ठीक. Fluid conservation by kidney and stimulation of adrenal medulla. कितना हुआ अपना? ठीक है, थोड़ा ही रह गया. So, in compensated non-progressive initial reversible shock, what happened first is the अभी देखो शॉक क्या है ये बोल मैं शॉक क्या है शॉक इज बेसिकली द लॉस ऑफ ब्लड वॉल्यूम फ्रॉम द बॉडी. ठीक है. अभी वो कैसे भी हो शॉक कैसे भी हो अपने को अपना ब्लड जो है वो निकल रहा है. ठीक है. इतना याद रख लो तुम कि ब्लड निकल रहा है. ठीक है. अभी ब्लड निकल रहा है, क्यों निकल रहा है? क्योंकि हेमरेज की वजह से. ठीक है. सो अभी अपने बॉडी जो है वो क्या करती है कि अपना ब्लड निकला है तो अपने ब्लड को वापस लाने के लिए कुछ ना कुछ जुगाड़ करते हैं, जुगाड़. ठीक है. अपनी बॉडी बहुत जुगाड़ है, बहुत शहानी है, बहुत शहानी है. ठीक है. वो क्या करती है अपने बाय द बाय द रीडिस्ट्रीब्यूशन ऑफ ब्लड से अपने अपने बॉडी को वापस मतलब ब्लड ब्लड लाती है टू द ब्रेन एंड हार्ट. अभी ब्रेन एंड हार्ट क्यों? क्योंकि दीज आर वेरी सेंसिटिव टू ऑक्सीजन. ठीक है. these organs can't survive without oxygen. ठीक है. तो ये अपनी बॉडी क्या करती है कि अभी देखो अभी ब्लड जो है वो पूरे बॉडी में है. ठीक है. तो अब अपना ब्लड जो है वो निकल गया है. समझो एक लीटर निकल गया है 5 लीटर से. अपने बॉडी के अंदर 5 लीटर ब्लड होता है अप्रोक्सीमेटली. ठीक है. सो उसमें से एक लीटर ब्लड निकल गया है. ओके. निकल गया. अभी 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 निकल जाने की वजह से क्या होगा कि 4 लीटर्स ब्लड है अपने बॉडी के अंदर. लेकिन अपनी बॉडी को तो 5 लीटर्स ऑफ ब्लड चाहिए. ठीक है. सो अपनी बॉडी क्या करती है कि जहाँ पर अपने ब्लड जो है वो इसेंशियल नहीं है, मतलब जहाँ पर उसकी इतनी ज़रूरत नहीं है. ठीक है. वहाँ पर ब्लड को नहीं जाने देता. एग्जाम्पल जीआईटी. अभी जीआईटी का अभी शॉक से ले, ले, क्या संबंध है उसका? ठीक है. सो जीआईडी जो है वो अपना शॉक के अंदर इतनी काम की नहीं है, तो फिर उसके अंदर से ब्लड जो है वो निकाल कर हार्ट और ब्रेन को दिया जाता है. ठीक है. सो अभी ये कैसे होता है? बाय वैसोकंस्ट्रिक्शन एंड फ्लूइड कंजर्वेशन. वैसोकंस्ट्रिक्शन मतलब क्या कि जहाँ पर अपने अभी अगर जीआईटी के एग्जाम्पल ले लो तो अपने अपना ब्लड जो है वो जीआईटी को कम देता है. वाई वैसोकंस्ट्रिक्शन मतलब अपने अपने वैसे जो पतली होती है इतनी होती है. ठीक है. ओके, समझ में आ गया. ठीक. सो वाइड पे वैसोकंस्ट्रिक्शन पूरे बॉडी के अंदर वैसोकंस्ट्रिक्शन होता है. ठीक है. विद हेल्प ऑफ बैरोरिसेप्टर्स, टीमर रिसेप्टर्स, कैटेकोलामाइन्स, रेनिन एंड एंजियोटेंसिन 2. ठीक है. अभी इसके अंदर ना ये रास सिस्टम भी इम्पोर्टेंट है, मतलब रेनिन एंजियोटेंसिन अल्डोस्टेरोन मैकेनिज्म. अभी इसके अंदर क्या होता है कि अपने बॉडी के अंदर जो ब्लड वॉल्यूम लो हो. ठीक है. तो आप मैक्युला डेंसा सेल्स सेल्स रहते हैं, एक ग्रुप ऑफ सेल्स रहता है जो कि अपने नेफ्रॉन के पास रहता है, ठीक है? तो वो स्टिमुलेट होता है, तो फिर वो रिलीज़ करता है, वो रिलीज़ करता है रेनिन, ठीक है? अभी अभी ये जो रेनिन है, ये रेनिन जो है, ब्लड के अंदर जाता है, ये करता है एंजियोटेंसिनोजन को एंजियोटेंसिन 1 में, ठीक है? फिर एंजियोटेंसिन 1 जो है वो एंजियोटेंसिन 2 में कन्वर्ट होता है वाया द एंजाइम कॉल्ड एज एंजियोटेंसिन कन्वर्टिंग एंजाइम, ठीक है? अभी ये जो एंजियोटेंसिन 2 जो है, ये डायरेक्टली चला है ब्लड वेसल के ऊपर, और इट कॉजेज अ vasoconstriction, ठीक है? एंड इट आल्सो स्टिमुलेट द adrenal medulla to to synthesize the aldosterone, ठीक है? अभी aldosterone जो है, ये जाता है DCT के ऊपर, और ये करता है यू नो अपटेक ऑफ सोडियम विद वाटर। अभी सोडियम सोडियम जहाँ पर जाएगा, वहाँ पर वाटर जाएगा, ओके? दिस इज द बेसिक प्रिंसिपल ऑफ द केमिस्ट्री। लाइक जहाँ पर भी सोडियम जाता है, वहाँ पर वाटर जाता ही है, ठीक है? तो अल्डोस्टेरोन क्या क्या करता है कि इट कॉजेज द इट कॉजेज द यू नो अपटेक ऑफ सोडियम फ्रॉम द यूरिन, ठीक है? सोडियम सोडियम अंदर आया, तो फिर वाटर भी अंदर आया, ऑब्वियसली, ठीक है? तो वाटर अंदर आने के कारण ब्लड वॉल्यूम जो ब्लड ब्लड वॉल्यूम जो है वो इंक्रीज होता है, ठीक है? और अगर ब्लड वॉल्यूम इंक्रीज हुआ, तो फिर क्या होगा? ब्लड प्रेशर भी इंक्रीज होगा। दिस इज कंपनसेटरी मैकेनिज्म, ठीक है? So there is increased heart rate, tachycardia, and increased blood pressure. However, in septic shock, there is initial vasodilation followed by vaso. Okay. So septic shock में उल्टा होता है, पहले vasodilation होता है, फिर vasoconstriction होता है. Besides, in severe septic shock, there is elevated level of thromboxane A2, which is a potent vasoconstrictor and may augment the cardiac output along with other sympathetic mechanisms. Clinically, cutaneous vasoconstriction is responsible for cool and pale skin in initial stage of shock. हम्म, अभी किडनी का क्या रोल आता है फॉर द कंपनसेटरी मैकेनिज्म ऑफ शॉक? सो पहले क्या करता है, वो अल्डोस्टेरोन को रिलीज करता है, ठीक है? फिर एडीएच को भी रिलीज करता है, ठीक है? एंड एंड अपना जीएफआर जो है वो कम करता है, ठीक है? And there is a stimulation of adrenal medulla to release to release catecholamines. Catecholamines मतलब क्या? Epinephrine and norepinephrine, which increase the heart rate and try to increase cardiac output. Hmm. Hmm. Progressive decompensated shock. So, this is a stage when the patient suffers from some other stress or risk factors, asthma, pre-existing cardiovascular and lung disease, besides persistence of the shock, so that there is progressive deterioration. The effects of progressive decompensation shock due to hypoperfusion are as follow are as under pulmonary hypoperfusion, decompensated shock worsens pulmonary perfusion and increases vascular permeability, resulting in tachypnea and adult respiratory ARDS. Tissue ischemia. Impaired tissue perfusion causes switch from aerobic to anaerobic glycolysis, resulting in metabolic acidosis. Lactic acidosis lowers the tissue pH, which in turn makes the vasomotor response ineffective. This results in vasodilatation and peripheral pooling of blood. Clinically, at this stage, the patient develops confusion and worsening of renal function. Irreversible decompression shock. The powers. हाँ, तो अभी जब अपना शॉक जो है वो हद से बाहर जाए, ठीक है। तब क्या होता है, शॉक इज सीवियर, सीवियर बहुत ही डेंजरस हो जाता है, जिसकी वजह से एक आदमी की मृत्यु मृत्यु भी हो सकती है। ठीक। So this is a progressive vasodilation during a later stage of shock. Anoxia damages the capillary and venous wall, and arterioles become unresponsive to vasoconstrict and begin to dilate. Vasodilation results in peripheral pooling of blood, which further deteriorate the effective circulating blood volume. Increased vascular permeability. Another damage to tissues releases inflammatory mediator which causes the increased vascular permeability. This results in escape of fluid from circulation and into the interstitial tissues, and thus deteriorating effective circulating blood volume. Myocardial depression factors. So, progressive fall in blood pressure and persistently reduced blood flow to myocardium causes coronary insufficiency and myocardial ischemia due to release of a myocardial depression factor (MDF). This results in further depression of cardiac function, reduced cardiac output, and decreased blood flow, worsening pulmonary hypoperfusion. Further, pulmonary hypoperfusion causes respiratory distress due to pulmonary edema, tachypnea, and adult respiratory distress syndrome (ARDS). Anoxic damage to heart, kidney, and brain. Progressive tissue anoxia causes severe metabolic acidosis due to anaerobic glycolysis. There is a release of inflammatory cytokines and other inflammatory mediators and generation of free radicals. Since highly specialized cells of myocardium, proximal tubular cells of the kidney, and neurons of CNS are dependent solely on aerobic respiration of ATP generation, there is ischemic cell death in these tissues. Necrosis. Hypercoagul what is this? Hypercoagula- Hypercoagulability in blood. Tissue damage in shock activates coagulation cascade with the release of clot promoting factors, thermoplastin, and release of platelet aggregators (ADP), which contribute to slowing of bloodstream and vascular thrombosis. In this way, hypercoagulation of blood with consequent microthrombi impair the blood flow and causes further tissue necrosis. Clinically, at this stage, progressive renal failure, the patient has features of coma, worsened heart function, and progressive renal failure due to acute tubular necrosis. Hypoxic encephalopathy. If the blood pressure falls below 50 mmHg, as occurs in the systemic hypertension, in prolonged shock and cardiac arrest, brain suffer from severe ischemic damage with loss of cortical function, coma, and vegetative state. Heart in shock. Heart is more vulnerable to the effects of hypoxia than any other organ. Heart is affected in cardiogenic as well as in other forms of shock. ओह! ओके। सो हार्ट जो है वो कार्डियोजेनिक शॉक में भी अफ़ेक्ट होता है और कुछ अलग टाइप के शॉक में भी इन्वॉल्व होता है। There are two types of morphologic changes in heart in all types of shock. Hemorrhage and necrosis. There may be small or large ischemic areas or infarct, particularly located in the subepicardial and subendocardial region. Shock. Shock lung. Lungs due to dual blood supply are generally not affected by. Oh, okay. Lungs due to dual blood supply are generally not affected by hypovolemic shock, but in septic shock, the morphologic changes in lungs are quite prominent term shock lung. Shock kidney. One of the important complications of shock is irreversible renal failure. The renal ischemia following systemic hypertension is considered uh, responsible for renal shock, for renal changes in shock. The end result is generally anemia and death. Adrenaline in shock. The adrenaline shows stress response in shock. This includes release of aldosterone in response to hypoxic kidney, release of glucocorticoids from adrenaline cortex, and catecholamines like adrenaline from adrenal medulla. In severe shock, acute adrenal hemorrhagic necrosis may occur. Hemorrhagic gastroenteropathy. The hypoperfusion of alimentary tract in conditions like shock and cardiac failure may result in mucosal and mural infarction called hemorrhagic gastroenteropathy. This result of this type of a non-occlusive ischemic injury of bowel must be must be distinguished from full-fledged infarction, in which case the deeper layers of gut, musculus, and serosa they are also damaged. In shock due to burns, acute stress ulcers of stomach or duodenum may occur and are known as curling ulcers. Liver in shock. Fuck. Microscopically, depending upon time lapse between injury and cell death, ischemic shrinkage, hydropic change, focal necrosis, and or fatty change may be seen. Liver function may be impaired. Other organs. Other organs like lymph nodes, spleen, and pancreas may also show of ischemia. So, ischemia is defined as a deficient blood supply to a part of tissue. The cessation of blood supply may be complete ischemia or partial ischemia. The adverse effect of ischemia may result from three ways. Hypoxia due to deprivation of oxygen to tissues. This is the most important and common cause. It may be of four types: hypoxic hypoxia, anemic hypoxia, cyanide hypoxia, and histotoxic hypoxia due to low oxygen in arterial blood. Okay. Malnourishment of cells due to inadequate supply of nutrients to the tissue, that is glucose and amino acid. This is less important. Inadequate inadequate clearance of metabolites, which results in the accumulation of metabolic waste products in the affected tissue. This is relevant in some conditions like muscle ache after ischemia from heavy exercise. Etiology of ischemia. So cause in heart, inadequate cardiac output resulting from heart block, ventricular arrest, and fibrillation from various causes may cause hypoxic injury to the brain. If the arrest continues for 15 seconds, he lost. Causes in arteries. The commonest and most important causes of ischemia are due to obstruction in arterial blood supply. They are under luminal occlusion of artery thrombosis and embolism. Vasospasms in Raynaud's disease, hypothermia, arteriosclerosis, polyarteritis nodosa, thromboangiitis obliterans, Buerger's disease, outside pressure, ligature, tourniquet, tight plaster bandage. Causing blockage of venous drain may lead to incontinence and Obstruction of arterial blood supply resulting in ischemia. The examples include the following: luminal occlusion of vein, thrombosis of mesenteric veins, cavernous sinus thrombosis, causes in vessel wall of vein, varicose veins of legs, outside pressure of veins, strangulated hernia, intus, intusception volvulus. Causes in microcirculation may result from occlusion of arterioles, capillaries, and veins. The causes are the under luminal occlusion of in microvasculature by red cells in sickle cell anemia. Red cells parasitized by malaria acquired hemolytic anemia, sludging of blood by white blood cells, in example in chronic myeloid leukemia, by defibrillation syndrome, and by fat embolism. Effects of HMA, the effects of HMA are variable and range from no change to a certain depth. No effect on tissues, if the collateral channels develop adequately so that the effect of HMA fails to occur. Functional disturbances, this result from when collateral channels are. Damn, guys, this was very long. Okay, guys. So we will end now, and mm, you know what, guys? I am planning to. I'll tell you later. Bye. Bye.